Hi everybody, welcome to our IASLC STARS presentation and Q&A this evening. Very kindly and very graciously, Kirsten and Janet have accepted our invitation to present to us this evening, and they're going to give a broad overview of IASLC, talk a little bit about that, about the World Conference on Lung Cancer meeting, and of course then talk about the S.T.A.R.S programme. And after that, I will ask a couple of questions that were submitted from our members, and I'll ask these to both Janet and Kirsten to find out a little bit more information about the programme itself. So with that, thank you both so much again for joining us. What is our evening and your early morning, so thank you very much for that. And if you'd like to start by introducing yourselves, that would be great. So I'll hand over to Kirsten and to Janet.
Wonderful. Thank you so much, Anne-Marie, and thank you for giving us the time and space to share a little bit about the IASLC along with our very important program, the S.T.A.R.S program, which stands for Supportive Training for Advocates on Research and Science. Before I dive into sharing more about the S.T.A.R.S program, I first would like to introduce a very important colleague in the collaboration of developing and managing the S.T.A.R.S program, and that's Janet Freeman Daly. Janet, would you like to share a little bit about yourself?
Thanks, Kirsten. I'm Janet Freeman Daly. I am a lung cancer patient now. I was diagnosed 10 years ago. I'm on targeted therapies and doing well. And as part of my journey, I became involved in advocacy and sharing my story, and then started learning more about the science. And I am now a research advocate working with the National Cancer Institute, the U.S. Food and Drug Administration, various nonprofits, all trying to make research more accessible and more effective for patients. And I wanted to help other people learn how to do the same. So I became involved with the S.T.A.R.S program with Kirsten.
Wonderful. Yes, and Janet has been a huge asset and support to work alongside, and I'm very, very grateful for that. Again, my name is Kirsten Ito, and I am the Associate Director of Patient Advocacy for the International Association of the Study of Lung Cancer, or IASLC, or you may hear it called IASLC. And the organization is a scientific membership organization. It's over 40 years old, and within the last 15 years, the organization has become to better involve patients, survivors, caregivers, and advocates within the membership. And then within my role, I work towards bringing these individuals in this section of our membership areas of opportunities to be involved in research and advancing lung cancer research. And that can mean speaking at our various meetings that we have around the world, former pre-COVID, that were in person and now are virtual. And also just through various activities. And S.T.A.R.S was created as a way to better involve these interested individuals to elevate themselves from their activities with patient advocacy into patient research advocacy, like Janet mentioned, of just really getting to better understand the science behind not only their diagnosis, but lung cancer as a whole. I mentioned briefly we have meetings. Our biggest meeting and kind of bread and butter of our organization is the World Conference on Lung Cancer. And this is a very esteemed meeting. Formerly pre-COVID, we would have over 8,000 individuals attend this meeting from various specialties, including nurses, thoracic surgeons, radiation oncologists, patient advocates, patient caregivers, the whole spectrum. And it really is a meeting that used to be every other year, but because of the advancements happening in lung cancer that are being done so quickly, the meeting has shifted to be every single year. And so the 2021 World Conference on Lung Cancer will be held this September, and it will be fully virtual, and it is free registration for patient survivors and their caregivers. So we will have a link to share to learn more about that coming meeting. And in addition, we also have complimentary or free membership for patient, survivor, and caregivers. There is a $50 membership fee for those who are within a patient advocacy organization. But again, we'll have more details, and I will provide my email address for any questions related to joining the IASLC as a member, but also for our coming World Conference. All right, so now I'd love to dive in with Janet on specifically of why we're here is the IASLC S.T.A.R.S program. Let me go into presentation. All right, are you seeing the correct screen?
I think you have it in presenter mode rather than presentation mode, possibly.
All right, there we go.
Yeah. Yep, perfect. Thank you.
All right, so just a little background. The S.T.A.R.S program was created now 3 years ago. We'll be entering in our 3rd year of the program. And it really was created by the inspiration of getting patient advocates interested in science and giving them opportunities to learn more about the science and how to get involved in advancing their research. It was no one person, it really was collaborative with coming up with the name, creating the details of the program, who would be involved in everything related to that. Janet, is there anything else you'd like to share with regards to kind of creation of the program?
The content of the program and the focus on it was based on patient advocates who had become research advocates and what they felt they needed to learn along the way. And the program is evolving every year as we learn more about what those needs are and an effective way to deliver it.
Yes. Okay, so for a very high level view, as mentioned on this slide, is that the S.T.A.R.S program aims to train, develop, and nurture lung cancer patient research advocates in the science and realities of lung cancer research. You'll see here on this slide, we have our list of our high-level goals that we try to achieve with this program. And the photo on the right is actually the first year of the program's participants when we were able to meet in person at the WCLC in Barcelona. It was such a wonderful time, and it's so sad that we unfortunately can't have this for the 2021 S.T.A.R.S program. However, Janet and I have developed ways to support the camaraderie and the networking available within this program. And hopefully in the future, we will be able to reunite at World Conference in the future. But yes, again, as you can see, here are the goals of the program, which we've identified at a high level. And it really is supporting the PRAs or patient research advocates in various areas of lung cancer research. And this can range within topics on biomarker testing, screening, immunotherapy, clinical trials, and many others. Anything else that you would like to share, Janet, related to the goals of the program?
Nope, you're doing great.
Awesome. All right. And again, like I mentioned, the 2021 S.T.A.R.S program will be fully virtual as it was in 2020. And this is a very high level view of elements within the program for this year. We will be partnering with Research Advocacy Network again for this year. They have created really wonderful educational modules or online lessons that you can take at your own pace. And they are basic on cancer as a whole. So while they aren't lung cancer specific, we can pull elements out there to dive further into as it relates to lung cancer research when we meet weekly as a group within the S.T.A.R.S program. Each year we do have a webinar Anne-Marie Barrett actually was our first webinar related to the program 2 years ago and gave a wonderful presentation on the biology of cancer. This webinar is still available and free to view on the IASLC website, and I'd be happy to include that as well. It's one that we definitely reference within the program and encourage folks to watch. The group has created a very valuable digital patient research advocacy handbook. This is a tangible tool for folks to kind of go in and reference various scientific words or concepts, and to have that handy for them as they're navigating their own lung cancer conferences or possible support groups, or even their own doctor's appointments or family members' doctor's appointments. Like mentioned earlier, within the virtual program, we do have meetings where we will have special appearances by KOLs within the research field of lung cancer, and also mentors that we have identified through S.T.A.R.S program who are well-established patient research advocates.
Kristen,
yes.
you might want to define what KOL means.
KOL, yes, key opinion leader. An example of a key opinion leader could be Dr. David Carbone, or Dr. Christine Lovely, Dr. Upal Basu Roy. It's not specific to just oncologists. KOLs can really range the spectrum of specialty to which they are related. Are there any other key mentions that you think I should share, Janet?
No, that's fine. And we do try and select an international group of key opinion leaders.
Correct, yes. We did have Dr. Quan Fong, who is an oncologist in Australia, and we're always open to including more international KOLs within our presentations to give international perspective on various topics. Additionally, on this slide, you'll see S.T.A.R.S Collide sessions. These were created last year as a way to foster kind of that missing networking and camaraderie that we weren't going to have at the physical WCLC meeting. And so these are a very general time together, informal, just to check in with one another, see what activities one another may be working on, or additional questions that may have come up during the RAN modules or within our actual presentations from KOLs or mentors.
And if
I
might say, those S.T.A.R.S Collide sessions where everyone gets to talk to other advocates and some of the key opinion leaders and ask questions or whatever's on their minds are something that the participants have said they value the most, just being able to network.
Mm-hmm. Yes. And it's a joy for us to get to know everybody on a deeper level from just the education layer. So it really has been a productive addition to the program. We also provide support and complimentary registration to the World Conference on Lung Cancer. It is a pretty extensive meeting with various tracks, including a patient advocacy track. And through S.T.A.R.S, we help you to kind of find the best way to create your own schedule to view this virtual meeting, and how to take care of yourself as well during a virtual meeting, because that is equally important as it is taking care of yourself at an in-person meeting. We also have opportunities for our sponsors of the S.T.A.R.S program to provide education. For an example, last year we had some individuals from Lilly actually explain kind of the process of how their lab works in development of drugs for lung cancer research. And again, it's an opportunity to network with these individuals, and with the hope that folks can stay in touch and possibly work together in the future. Finally, for the culmination of the S.T.A.R.S program, we do ask that participants, PRAs specifically, to present on their chosen focus topic. And this can be within various topics listed before, just a few: clinical trials, screening, biomarker testing, immunotherapy. Janet, what are the two others?
Small cell lung cancer and clinical trials.
Yes, thank you. And our hope for these presentations is for them to be in a way where the individual feels the most passionate about their advocacy work. So it could be practicing for a scientific presentation or creating a brochure. We even had an attendee or participant, excuse me, create a digital video, an explainer video. So there really are no rules to how the presentation is done, just in a way that you feel inspired, and it ultimately will help the community. Janet, are there any other additional details to share on virtual elements?
No, we're talking about adding some additional material and finding ways to enhance the networking even more for next year. So
yes. So this next slide details a high-level view of the 2021 program timeline. Now you'll see on the far left that the applications are currently open and will close May 10th. It is a very easy to use online application where you answer a few questions about yourself and then also send a request for a recommendation. And so we ask that the recommendation come from someone who knows your advocacy work or goals for advocacy work in relation to research advocacy. And these questions will be the same for everybody. So that way we are looking at all applications fairly and equally. If you do decide to apply and you have any questions at any point in time, you can always save what you've completed within the application and return to it, or reach out to us with any questions. Again, you'll see the various items within the program that we've already discussed with relation to presentations from KOLs or mentors. We have our RAN modules and also the STARS Collide, and then concluding the program will be the presentations from PRAs. And then in the middle, we have the World Conference on Lung Cancer again, which is virtual. Janet, are there any additional details related to timeline?
no.
Perfect. All right, so this concludes my slides for the STARS program. Before we dive into questions from Anne-Marie, I would like to share just a quick video where you can hear some testimonials from past participants. So give me one moment here.
The STARS program has really equipped me with some tools going forward that are going to help me help other people in the community.
I love the different formats in which we meet and learn.
It just gave me confidence that I had a bit more knowledge than I did before I started on what I was doing was right.
Gathering that group, every session and hearing those lessons has really given me ideas to take back to my own advocacy work.
It is like a family.
The S.T.A.R.S program has actually helped me to look more deeper into our reality in Nigeria.
It gave me the confidence that I needed to be able to take not just my voice and my experience, but the experience of the whole community.
You learn how to read the science, decipher the graphs, understand the jargon, understand how the science is presented.
I just felt really safe and supported and felt like it was a really nice, nurturing environment.
It's a fantastic learning experience and lets you take your knowledge to the next step.
That was fantastic. Thank you both so much for that overview. It was great to hear more about the IASLC and about the conference and about the S.T.A.R.S program itself. So really appreciate both of you putting that together and giving the presentation to us. So if it's okay with both of you, I'll dive right into the questions. So I think the first question is not necessarily application specific to S.T.A.R.S, but for some of our members, there's a little bit of a misunderstanding as to what a patient advocate is and a patient research advocate, what a patient research advocate is. So maybe you'd like to, maybe Janet, I don't know, would you like to take that one? Just to,
Sure.
so people are aware of what the differences are. So when they're applying to this program to be a patient research advocate, what exactly that would mean.
Thanks for the question. Patient advocates, that's a very broad term. It can be a patient or a caregiver who is interested in expanding awareness or providing education or raising funds for their particular disease. In lung cancer, it's usually once a patient feels healthy enough or the caregiver has some time, they might join an advocacy organization and participate in a walk to raise money. Or they may share their story to help motivate other people or to educate people. They might join a patient group online or in person to talk about their particular disease. But it's primarily focused on sharing the patient experience to other people to tell them what it's like in their particular case to be a patient. As a patient research advocate, you actually are speaking for a large number of patients across your disease type to help researchers understand the patient experience and to put the research priorities where they belong, to modify research programs so that it better addresses patient needs. For instance, you might help to define what a research protocol looks like for a clinical trial, or you might provide feedback on a scientific document, or you might participate in a consumer review program to select which grants might be funded. And that doesn't mean you have to understand the science at the level of a scientist, but you do need to understand the science and think about what would have the greatest impacts on patients. Would it be better to spend money on immunotherapy or targeted therapy or chemotherapy? What types of research might work if you were just trying to do some basic research? So in order to do that, patient research advocates have to know when and when not to tell their personal story. They have to know the science well enough to be able to understand at a high level what's being discussed and what the priority should be, and they need to be able to interact effectively and respectfully with researchers and clinicians to help them understand the patient experience.
That's fantastic. Thanks so much for that, Janet, because I think sometimes it does lead to a little bit of confusion for some of our members. So following on from that, if you were just starting out in advocacy, so either you're more newly diagnosed or you've only now made a decision maybe a couple of years out that you want to get involved in advocacy to do something for the lung cancer community, is this the right thing for someone to do now, or would you need to be a little bit more sort of established within the community to take part in the S.T.A.R.S program?
That's a good question. I think it does depend on the individual. The IASLC does offer educational awards. They were previously called the Patient Advocate Travel Award, and this was specifically for the World Conference on Lung Cancer. We are going to be developing a virtual version for the 2021 WCLC, and then hopefully an in-person again. And that would be a really great introductory opportunity for someone in a situation to which you're speaking to, Anne-Marie, of just kind of slowly building the network and kind of seeing what a scientific meeting is all about. However, if someone is newly diagnosed and they're feeling healthy, they're on the right treatment, and they're gung-ho about the science. You know, maybe they have a scientific background. You know, it really does depend on the individual.
And I would say, if what you're looking to do is learn how to tell your story or share it in the media, this is not the right program for you.
Correct.
Okay.
But there are different levels of advocacy in different countries. We've had one participant from Nigeria where there are no other patient advocates, much less patient research advocates, and he's starting from scratch. So we do try to evaluate the country, where the country the person is in, what their background is, in terms of how they could make an impact for lung cancer in their country, not just whether or not they've done any advocacy at all.
So I guess the advice would be, if they've queries, to reach out to both of you, and if they feel that they do fit the criteria, to go ahead and submit an application, and it would be judged on the merit of where the location is and things like that. Yeah, perfect. Yeah. Thank you so much for that. The next question we got is, what is the time commitment like for the program? So what is kind of a weekly time commitment look like? Is it a couple of hours, or is it shorter or longer than that?
Yes, for this year, we will be asking folks to commit roughly 2 to 3 hours a week, depending on their learning style, as well as the way they absorb information. Everyone is different with that. And the great thing with leaning on Research Advocacy Network with their modules is you really can consume that information at your own pace. And additionally, we're planning on having pre-recorded scientific educational sessions for participants to view before we all meet as a group. This way, it gives you opportunity to, again, digest that information at your own time and speed, and then come ready to connect with that presenter, KOL, or mentor, and ask those questions that you might have after viewing the information. So, yeah.
Janet, did you want to add something to that, or?
Yes, and then we'll also have some sessions where we discuss. We have people who are already involved in research advocacy discussing what they do, that people can choose or not choose to participate in those sessions, but the networking is something that most of the PRAs have told us is the most important part, so we wanted to make it available.
Perfect. And then my next question, which you sort of answered already during your talk, Kirsten, but I'll just ask it just to maybe get a little bit of a wider view. So the question was around, do I need to complete a project? And can you pick the focus topic that you want to do, even if other people have picked that focus topic? So I guess two things, the project, and then is it a case of multiple people pick the area you're in? Does that mean then you might have not got a choice in what you might end up doing a project on?
That's a great question. Great couple of questions. Yes, as noted earlier during the presentation, we do ask that selected participants present on their chosen focus topic. And it is absolutely okay if there are multiple people who have chosen the same topic. The unique piece of that is we could have two people have chosen clinical trials, for example. Specifically what they go into on that broad topic will vary, and the way it's presented will be different. And we will have mentors to help, work through the PRA's, style of presenting or preferred way of presenting and gathering the information that they want to share with the group.
And also to point out, the purpose of this presentation is not to have you create a speech you're going to stand up in front of hundreds of people and deliver. It's delivered within the S.T.A.R.S program, which is a very supportive group. And the intent is for you to present to the audience that you would be working with as an advocate, as a research advocate. So some people decide to talk about biomarkers that are important to their group. Some people decide to branch out into an area that's new to them and share what they've learned. Some people have made flyers, some have made videos. So the format can vary depending on what the person is trying to accomplish with their own research advocacy.
Perfect. Sorry, just one more note.
No, of course, go ahead.
It's very important for us to create a safe space for presenters. Presenting virtually is still a bit nerve-wracking, but I like to think that if you have those butterflies in your stomach, it means you care. And everyone within the S.T.A.R.S program cares about one another and wants everyone to feel safe with practicing. So just wanted to.
And then leading on from that, another question, is there a test that I have to pass to have successfully completed S.T.A.R.S to get, say, the S.T.A.R.S certificate?
No.
No. We do have the online training modules, and some of them may have a test at the end where you click buttons to show your understanding, but we don't grade them and we don't record them and we don't scold you.
That's good to hear, because I guess some people do worry if there's kind of an exam type situation to feel under pressure with that.
No.
And obviously we're coming from a European perspective, and there's multiple languages. So one of the questions we got in was, my English is okay, but not fantastic. Would this be a barrier, or can you help me if I need a little bit more help to understand what's going on?
Absolutely, we would be willing to help. The ultimate goal is to grow this program internationally. The tricky part is currently with a lot of, with all of IASLC meetings specifically, they are spoken in English. However, if there's ways we can create tools for those where English is a second language and not as strong, that we can help develop, we are absolutely committed to support that. And hopefully, you know, we will work towards expanding and having translated resources available as well. And that's really where the networking can come into play with participants and us working with them to hear what they need. I can't assume or know what is needed in other countries unless it's shared.
But that being said, for now, all our materials are in English. We are going to work on translating them, but I can't say that they will all be translated before the program starts this year.
Mm-hmm. Well, you've led into my next question, which was I'll start that question again. The materials that are supplied as part of the S.T.A.R.S program, are people allowed to translate those, or is there assistance in translating them? So I think what the person meant by this is if there was a resource that they had access through S.T.A.R.S, is there is there a pathway for them maybe to share those resources with members of their organization or within their group?
I mean, I believe, Janet, please jump in too with this, that if we could work together with that individual or that group to translate our materials appropriately so it stays consistent, I think that would be a really wonderful opportunity just to make sure we keep the branding and everything intact and where the information is from. But I think that would be a wonderful opportunity to expand, because we do have very strong resources created right now.
And I don't know how long it will take us, but it is our goal to have all of the videos translated, at least a translated transcript, if not subtitles. But it might take us a while to get there. So to be honest, you will need to be able to understand spoken English to get the most out of the program at this point.
Okay. Okay, no, that's good to know for everybody. Then another question we had was around mentors. So it's a wee bit of a two-parter question. So one is, can my own doctor or the doctor that I'm dealing with be my mentor? And how are mentors chosen? You know, do I have a say in the mentor that I might get?
That's a good question. So for this year, we are changing the program a bit in that we aren't having applications open for mentors and are going to be leaning on past mentors of the program and also within the field. So if an applicant as a PRA sees their doctor or other care team member as a mentor in their research advocacy growth, we would love to be connected with them to see if they would be willing to be a KOL for a future presentation. That could be a great way to get them or their institution involved in our advocacy efforts of education.
And again, KOL is key opinion leader.
Yes.
Yes. The concept of mentor within the program is that these are people who are active research advocates, so that they can help people understand what research advocacy is and how they can develop their research advocacy efforts. So as Kirsten indicated, we separate the concept of mentors from people who are clinicians or researchers. We call them the key opinion leaders.
No, that's good to know that distinguishment between the two, because again, that can lead to a little bit of confusion. And just in terms of selecting the mentor or the member that might be kind of, you know, I'm going to use the word applied to you, but assigned is the word that I'm looking for. The mentor that's assigned to you, does the applicant have any kind of input in that, or how is that done?
Can I take that? We do not assign an individual mentor to an individual PRA. We have a pool of mentors, and they will be sharing their background and expertise, and a PRA can pick the person to whom they feel would be most useful to them or is best representative of what they want to do, and connect with that person.
Perfect.
We've learned, within the 2 years so far of the program, that each mentor has different strengths to bring. No one is the same. And so having this pool or group of mentors has been very valuable for everybody to lean on, depending on their interest.
And we also understand that having mentors from different countries is useful, because advocacy is different in different countries.
And I mean, it's a really great opportunity to bring everybody together and share experiences even outside of the setting of S.T.A.R.S. So that's great. And I'd be very happy to know I have one final last question. And it's a little bit more sort of post-S.T.A.R.S. So someone is wondering, after completing the S.T.A.R.S program, what have other people gone on to do, or what, having sort of this training from S.T.A.R.S, you know, what might I be able to do with that maybe I wasn't able to do before? So that's a little bit of a broader post-S.T.A.R.S question.
That's a great question. Janet, do you want to take it?
You're going to hand that off to me.
I'm happy to.
Actually, Kirsten, I think you know. I'm just messing. Go ahead, Janet.
So having the additional background in science, the PRAs have said it made it much easier for them to understand what information is important to share if they're in a particular patient group, but also it helps them understand if they're involved in looking at different grant proposals, they can understand them better and provide more effective input. They can learn how to get involved in some of the regulatory activities in their country. I am now involved in a federal committee that looks at human research protections. There are groups that look at clinical trial options. One of the S.T.A.R.S mentors is involved in Australia with their Australasia clinical trials group. There's another one has become involved with the NCI's oncology program. So it hopefully gives you a much better ability to contribute to these programs. In reality, the people who look for research advocates to join their programs, they want to know that you understand the science and that you've already interacted with researchers, and we give you some of that opportunity.
And I think to add on to that, it's really important for Janet and I to stay connected with past participants, and something that we're working on is establishing a more formal alumni program or past participant program of, you know, if we hear of opportunities for possibly speaking at a conference or reviewing a specific survey or just being involved in the research setting, we want to build and foster those relationships to make sure we have this really solid network where we can recommend people for activities that they might be interested in.
Another example that we just started is a partnership with an organization called GRASP, who provides an opportunity at major oncology conferences like ASCO and the San Antonio Breast Cancer Conference, but we're looking at also doing maybe World Lung, where patients can do a poster walk with one of the key opinion leaders and a research advocate to learn more about the science and how to read a poster. And some of our graduates will be participating as the mentors for those programs.
That's fantastic. That's absolutely amazing, and well done to everybody involved. And as I say, that was my last question to you both. So I don't know if there's anything else either of you would like to add before we close the session off. So I'll open up back both to you if there's any final thoughts.
I'd like to share that I'm involved with the Ross Wonders, which is an international organization. We have members in 36 different countries. And we've come to understand that advocacy is at different levels of development in a lot of different countries, and that language is a barrier. But we would really like to work on overcoming that. We would like to help more people be able to be research advocates in their country. And if you're not starting at the same level as people in a different country, that's okay. We want to help you develop research advocacy in your country.
That's great. And I just echo my gratitude to Anne-Marie and Janet for giving us the space and time today to share more about IASLC and specifically the S.T.A.R.S program. I hope this answered questions effectively. However, if there were more questions, please don't hesitate to reach out to myself or Janet, and we're happy to work with anybody and kind of figuring out the right place to support you.
Well, that's absolutely fantastic. And for me, on behalf of Lung Cancer Europe, I just want to say a huge thanks to both of you for giving your time so freely this evening and for giving us that presentation and for answering all those questions. Just to say that we really, truly appreciate it, because obviously for us too, we want to facilitate as much as we can for people to get involved in programs such as this, because we know that it has such a positive influence and benefit for the entire community, no matter where you are. So thank you both so very, very much. And I hope, fingers and toes crossed, that you'll get a lot more applicants from Europe. And obviously for any of our members, they can reach out to you, as you have said, if they have any queries or questions. And if they have any queries or issues they want to pass by Lucia first, please feel free to do so. So thank you both so very much for your time this evening.
Thank you for having us.